Hi, my name is Holly Hughes. I'm the Egg Donor Gestational Carrier Coordinator here at Brigham and Women's. I'd like to welcome you today to the recipient class of the donor egg cycle. Today I will be going over, you have been handed a red packet. I will be going over the contents of the packet. I will be going over the medications to be used in the cycle. And for those individuals who have previous IVF experience and are experienced with injections, I will, for those people that are not experienced, I will go over that at the end of the class. Your doctor has recommended the use of a donor in your cycle. It is necessary for us to do preliminary testing, those testings that involve communicable diseases. So we're going to be drawing blood from both you and your partner. You will also be required to have a office hysteroscopy. The purpose of the office hysteroscopy is for the doctor to look inside the cavity of your uterus to make sure that there's no obstacles, that everything is okay. You will, at that time, be having a PAP and cultures. When all of those are complete, here you are for class today. I'm going to go over the medications used. The role that you're playing in this as the recipient is we need to get your uterus ready for implantation, for transfer of those embryos. And what is involved in that is the medications. The first medication that we will be using is birth control pills. So if you walked out of here and only remembered to call me with your period, that would be wonderful. The first of the medications is birth control pills. Why do we use birth control pills? We use birth control pills to synchronize your cycle with that of your donor. And that enables us to begin the medication much more easily. If you called with your period, we will tell you when to begin. In your packet, you have little stickers that say what dates you've begun, so you can keep track of that. You will be on the birth control pills maybe for 1 to 2 cycles. We will tell you if we want you to take the placebos. But be sure if you're getting towards the end of the real pills, you need to call us. We need to talk. So the first of the medications is birth control pills. We will then give you instructions to begin the next phase of medication. And the next phase of medication is the medication Lupron. Lupron's role is to suppress hormones. It's administered with a small syringe, and it's given every day between 5 and 7 in the morning. The vial that you will be getting will be a very small vial, and it has a 2-week supply in here, more than enough to get you through the cycle. And we give you a refill should you need it. This is given every morning between 5 and 7 in the morning. Again, it's given with the needles that accompany it, and it's the, oh, sorry. You'll be given it with the needles accompanying it. You'll be taking 10 units every morning, and the increments are right on that. We will tell you when you begin your Lupron when to stop the birth control pills. You'll be basically stopping 1 week into the Lupron. So about 7 days of the 7th day of the Lupron, you'll stop the birth control pills. That in turn triggers you to get a period, and we want you to get a period. We will have you then, in turn, we will give you a date to come in for a blood test, and we refer to that blood test as your baseline. The baseline is to look at, did the Lupron do its job? Did it suppress? Is everything quiet? Your nurse will be calling you that afternoon. You will sign in, and I'll go over all the information in the packet, but your nurse will go over that afternoon when the blood results come back. She will call you, and she will tell you to begin the next phase of medication. And the next phase of medication is estrogen. Estrogen comes in two different forms. Pill form, which is this teeny little pill, and you'll be taking 3 pills in the morning or 3 pills at night. Now, your doctor will either prescribe the pill form or the patch form. And the patches come, they're transdermal patches. And these are the patches. The patches, if your doctor prescribes the patches are applied in the mid area. So around where the belly button is, and you can go right around your whole mid area. We ask that you do not apply this to the breast area. We do not want you to get direct estrogen to your breasts. I do not want you to put it on your arms or legs either. I really want you to put it on your mid area. The usual dose will be 2 or 3, and you'll change it every other day. Rotate these patches as you're putting them on around the mid area. The biggest thing about the patch itself is the adhesive. The adhesive tends to make people's skin get irritated, so that's the rationale for changing the site. When you begin your estrogen, you will be told to drop your Lupron dose now down to 5 units. So you will be continuing the Lupron. So now you'll be doing Lupron and estrogen. What is happening with your donor at this point? At this point, your donor is, when you start your estrogen, she's starting her Lupron. We need to start you first on the medication because we need to get that lining thickened up, ready for that transfer. Your nurse, when she gives you the instructions to begin the medication, she will tell you when you need to come back in for testing. And in the red packet will be your forms for coming in for testing. So you'll have the forms within there. Now, meanwhile, where is everything happening at this point? Well, your donor's going to be on 10 days of Lupron. She's going to have her baseline, and then she'll begin her stimulating medication. So it'll be about 20 days after you've started your estrase that we'll be talking to you about it's time for her retrieval. Now, significance for the husbands and the retrieval is that they need to come in the day of the donor's egg retrieval and produce a specimen. Make sure your husbands have had an ejaculation within the week. If they have not, they need to take care of that. And once we tell them the time, we'll tell you 2 days before, once we tell him the time to come in, we want him to abstain at that point. We want his sperm swimming well on the day of the retrieval. He will report upstairs to 5C. That in the tower is where our IVF lab OR suite are. He will report on that day, and he will make sure he brings a license and his blue card, and he will produce a specimen. Meanwhile, the donor is having her egg retrieval that day. On the day of the donor's egg retrieval will be when you start the next phase of medication, and the next phase of medication for you is progesterone. Now, progesterone comes in 3 different forms. The majority of the time, the form we use the most is an injectable form, and that's progesterone in oil. It's in either sesame or peanut oil. So if you have an allergy to either of these products, please do tell us. This injection is given intramuscular. So versus the Lupron, under the skin, the little shot, this is given with a big needle. The initial dose, so you will begin that the day of your donor's egg retrieval. That will be your last day of Lupron. You will continue your estrogen, because remember, that's your lining, so you do want to continue the estrogen. Critical. The progesterone now is the hormone that if this pregnancy is going to take, this is the hormone that's the glue. This is the hormone that's going to hold that pregnancy. Critical. These two are critical. The first dose on the donor's egg retrieval day will be a half a cc. Thereafter, it's bumped up to 1 cc. It's given in the buttocks, ideally. The other place, of course, is the thigh. But the thigh people tend to say that hurts. Most people use their buttocks. If you have someone able to give you the shot, that would be great. Some people, because if you get pregnant, you're going to be on this for 10 weeks. Because of the oil, it tends to make people's buttocks lumpy, a little sore, tender. So a lot of people will ice the site before they give the injection. I would be faithful at alternating side to side. Put it on your calendar. Make sure you're bringing it side to side. Continue the estrogen. the day of the donor's egg retrieval is your last day of Lupron. So that 5 units is the last day, and now you're done. Alternate forms, if your doctor, per the doctor's order, of progesterone is progesterone suppository. This is a suppository that's inserted into the vagina. It's inserted 3 times a day. Now, this sounds inviting, but I've got to tell you that the suppository itself, they tend to leak a lot. We ask that you lay down for half an hour after insertion, and they do leak a lot. They're not as inviting as they seem to be. The other form of progesterone is the product called crenone. That's also inserted into the vagina. If you are using the crenone does not start until the day after the donor's egg retrieval. And this product, it's an applicator. You twist off the top, put it into the vagina, and squeeze. The day after the donor's egg retrieval, you will be called with fertilization results. How did the eggs and the sperm fare together? What is the fertilization results? You will then be coming back in on day 3 for your transfer. So the following day, you'll get a call with what time to come in for transfer. As you, the recipient, there is no anesthesia involved, so you can have a light breakfast that morning. You will come into the same place that your husband gave a specimen. You'll come into 5C. Make sure you have a ride with you. You will be given a Johnny to put on. You will be brought into the OR. Now, embryology is behind the wall in that OR. There's a fair opening there in the door, but what's happening behind there is they're preparing these embryos. They're putting them into a thin catheter. The doctor will talk to you about the number of embryos to be transferred. That may be 1 or 2. With a young donor, the chance of multiples is very great, so they may be talking to you about only transferring a few embryos. You will, in turn, the doctor will come in, they check names, the embryo is, you're put into the stirrups, the embryo is passed the cervix, put past the cervix with the catheter, and the embryos are pushed gently. The catheter is handed back to embryology to make sure that there are no embryos left behind, none stuck on the wall of the catheter, and you're brought into the recovery room where you'll hang out for 20 minutes to a half an hour, and at that point you'll go home. I ask that you, when you go home, that you take it easy. You do not go back to work that day and the following day. Just take it easy. Does that mean you're on strict bed rest? No, but it means you're on modified bed rest, that you need to take it easy. Have someone cook for you, or have your husband bring home dinner for you. Get a good book. You're just going to take it easy. You can get up and go to the bathroom, get yourself cleaned up, but you're really just going to take it easy. When is the pregnancy test? 15 days after transfer. So what are you doing in the interim? What are you doing for those 15 days? You are continuing your estrogen, and you are continuing for your progesterone. Now, on day 15, if the test comes back positive, you will continue these for 10 weeks. It's a long time. But remember, this is the sole support for the pregnancy. We need to support the lining, and we need to support the hold for the pregnancy. If you are pregnant, you will be given a date to return 48 hours later for another pregnancy test to make sure the levels are rising appropriately. And from there, we will schedule you for an ultrasound. I want to go back one step, is that, and I share this with you all, is that you need to make sure before you even start all this that you're on a good prenatal vitamin. You can get one over the counter, that's fine, but you should be on a prenatal vitamin before you even start this process. Now I will go over, and if you're not pregnant, you stop the medication. With the use of progesterone, some people don't get a period, so do not stop this medication until you've had your pregnancy test. I would like to now go over the contents of this packet and go over your consent forms with you. Each of you will be given specific instructions from your doctor How much estrogen do they want to give you? How much and what kind of progesterone do they want to give you? On the top here also will be when you and I are all done getting all the labs together, you're feeling comfortable doing this process, your donor is done, I will transfer your cycle over to your doctor's nurse, and she will be the one manning the cycle. So we'll fill in here who your doctor is and who your nurse is so that you'll have that contact. Keep in mind, if something happens to that nurse or something happens that you came in for testing on that day, remember that you have that doctor on call. So, it's late afternoon, nobody's called you, you can call the number and ask for the F&E doctor on call to get orders. And usually the F&E doctor, if the calls haven't been made back, she'll call that nurse to give you a ring. We have many, many consent forms here to go over. This consent form goes over, I want to do donor egg. This consent form goes over all the side effects of the medication. What are the side effects of the medication? Lupron, remember, the role of Lupron is to suppress the side effects of that, difficulty sleeping, hot flashes, headache. What is okay for you to be taking during cycle for pain relief? Tylenol. Tylenol is it. So no aspirin, no Motrin, no Aleve, just Tylenol. Extra strength is okay also. Estrogen. Some people get a little bit nauseous. They get bloating. To be honest with you, most people don't have an issue with this. With the patches, the biggest thing I find is people have sensitivity to the adhesive. So be faithful about changing sites. And the progesterone. The progesterone of all the medications, if you're going to have a side effect, the biggest one would be the progesterone. Progesterone, and it's because of the base that it's in. So if you've had any adverse reactions in the past, please let me know so that we can order you an alternative form other than the injectable form. But progesterone is the hormone when a woman is PMSing, it's the progesterone. So some people get a little crabby. So keep that in mind. If you're feeling a little fragile and crabby, it's probably the progesterone. But hang in there. Hang in there. This piece also goes over all the process that we do. Part of our process is we have you see the nurse, the doctor, and the social worker. This process goes over communicable diseases. This goes over the risk of multiple births. All of these are touched upon. You sign this, and it needs to be signed in front of a hospital witness. This cannot be signed at home with your cousin or your mother or anyone. It needs to be signed in front of a hospital witness. Let's say you cannot get it signed with a hospital witness. You want to bring this home and you want to read it together, but you do not want to come back in. You can forward it back to me signed in front of a notary. Banks have notaries. So call your local bank, make sure the notary is available, and you can get it notarized. That's an alternative form. Over on this side, so you both sign this. Both partners sign this. Over on this side goes over what do you want to do with the remaining embryos. Option 1, fertilize all the eggs with the sperm. Give me back the best and discard remaining. That's option 1. Most people choose the next option, and that is fertilize them all, give me back the best, and if there are remaining embryos of good quality, and they do need to be of good quality, freeze. Freezing gives you the option to do this cycle again without using a donor. So if you get pregnant and you want to come back, you can get a sibling from this process. Or if it doesn't work, you can do this cycle again. A frozen cycle, a cryo cycle, is the same exact process that we're doing right now. Option 3, if you had ethical or religious beliefs about the discarding of embryos, option 3 says fertilize only 2 eggs. Those eggs may not fertilize, so you run into the risk of having nothing to transfer. But it's an option there. The next consent form is the lab's consent form for freezing. This one goes over freezing, and it goes over I want to freeze or I don't want to freeze. Now, over on this side, this goes over all the dilemmas of life that could happen to any of us. Remember, these embryos are the property of only you and your partner. They are not the property of mine or your cousins or your grandmothers. They're only your property. And you'll see as I go on in this. Option 1, in the death of the female partner, does the husband want the embryos or discard? In the event of the wife dying, does the husband want them or discard? In the event of both deaths, discard is your only option. The last option is divorce, and this is a touchy subject to talk about. Most people haven't even broached this subject before, and now here we are in this consent form touching upon this. Female partner, male partner, or discard. These embryos are kept only for 3 years or until the age of 45. Now, many of you are already 45 or over. Does that mean you can't freeze? No. It means you still can freeze, but we truly encourage you to come back and get these embryos. And the bottom is the financial obligation that you agree to pay to keep these here in a cryo state. As of May of 2005, the FDA came into the picture. And the FDA said whenever tissue is transferred from one individual to another, we need to do more testing. We need to make sure the product we're transferring back in, the best of our knowledge and the best of everything, is we're not transferring communicable diseases. So what this is saying is your donor at her baseline will be having FDA screening. In addition to her baseline testing, she'll be having FDA screening. That means she'll be having HIV, hepatitis, syphilis, and she will also be having cultures, gonorrhea and chlamydia cultures. If any of these should come back positive at the time the FDA bloods are drawn, this consent says we have to stop the cycle. The government says we can't transfer these to you. We can't freeze them. We can't test her again. It's over. And that's what this is talking about, this consent form. This consent form goes over if an event comes up, and what they're referencing in this consent form is ICSI. Let's say the day of your donor's egg retrieval, your husband's sperm weren't swimming. They may call you and say you need to do an ICSI procedure where they inject the sperm into the egg. It may not be covered by insurance, but it's an option you have. And this is what this is saying, is that something may come up that insurance doesn't cover. You will be notified, though. You will be notified. And make the choice. Certainly if you want to get these eggs fertilized, but it's certainly something that could possibly come up. This consent form is Lupron consent form. Lupron, remember I talked about Lupron as the drug that suppressed hormones. Originally approved, FDA approved 20 years ago in the use of breast cancer and prostate cancer because it suppressed hormones. We've been using it for many, many years in reproductive medicine, and we've been using it at a very low dose that's been very safe. But because it's an off-label use, we need to notify you. Again, they talk about the headaches, difficulty sleeping, hot flashes. Remember, Tylenol is your choice of pain medication. Now, if you get pregnant, the same thing goes. Tylenol is it still, even with pregnancy. This consent form says in the laboratory they need to submit information to the Center for Disease Control. This is acknowledging all identity is kept confidential. This is the audit consent form. Each reproductive medicine program in the United States submits their data, or prominent ones submit their data to the American Fertility Society. And this data is published. So anyone could look at this information and see what the pregnancy rates are. This consent form is saying if these people came to our site and audited us, could they look at your chart to verify, yes, you're pregnant? And could they call you? They would actually have one of us call you and verify pregnancy. And you could say, no, I don't want to get a phone call, or I do. Your choice. This is the consent form for use of discarded embryos. Now, remember I talked about you're going to get the best embryos transferred back to you. Always the person gets the best. The remaining embryos, if they are of quality, and you've chosen to freeze, they will freeze. Keep in mind, those embryos need to be of good quality because they need to survive both the freeze and the thawing process. So that's the rationale for only freezing high-quality embryos. What this consent form is asking you, and this is a consent form from the laboratory, is asking you if there's embryos that they will be discarding because they're not of quality, could they use those for laboratory purposes? They're not to make babies. They're using this to make their techniques more proficient. But that's what this is. You do not have to do this if you do not wish to. Your choice. The last of the consent forms. The last of the consent forms is your donor will be coming in for screening. She'll be coming in to see the doctor. She'll be coming in to see the nurse. And she'll also be coming in to see the social worker. And that's part of the screening process. What this consent form is saying, do you want to do additional psychological screening? Do you want her to see a psychologist and be tested to make sure she's okay? Your choice. Now, she's seeing the social worker, but some people want to go one more step. This is an addition. Both of the things I will be talking about are additional monies. The psychological screening is an additional $500. And the other test that you and your husband need to talk about is, do you want to do blood chromosome analysis on her? That's also going another step. Is that something you want to do? It's a blood draw. It's easy on her, but as far as fees-wise, it's $1,400. It is a lot of money, and that, too, is not covered. You do not have to do this if you do not wish to. If you want to, that's fine. We ask that you sign this piece before you leave class today because when the donor comes in, we need to make arrangements for her to see the psychologist or get that blood screen drawn. The blood screen does take a couple of weeks to come back. In your packets, you will also have a book. And this book goes over all the sites. This is a nice little book. It goes over all the sites where you can go for getting your blood tested. Most people come up to the third floor right down the hall from the Center for Reproductive Medicine to have their blood drawn. If you need an ultrasound is located down in L1. And then the map for the 5th floor, where you're going to be going for your procedure, your transfer, where your husband's going to be giving his specimen on the day of the retrieval, all within here. Also in here, it goes over sites for injections. You have a brain cramp and you forget where to put the Lupron. It's in here. Or you forgot where to put the progesterone. And it also goes in here, which is very nice. It goes over all what's going on in the laboratory. What are they doing with the eggs? What does the transfer look like? And the pregnancy test. That's the end of that. Keep in mind, part of our program mandates that you see the social worker and the donor see the social worker. We are concerned about your physical health as well as your emotional health. We ask that if you need the social worker during cycle, utilize them. That's what they're there for. She can also talk to you about other options. Acupuncture, a lot of people use that. Mind-body center, wonderful option too, just to utilize. It's important that you be in a good state emotionally. And then also in here will be forms for ultrasound forms and blood forms, so that you'll have a standing order for your blood forms, and you will have an ultrasound forms when you go down, if you're requested to go for an ultrasound. Be sure when you go in for testing that you sign in, that you will sign in. There'll be a sign-in sheet located in downstairs in ultrasound, and on the blood area that you sign in, because we need to know where to find you on that day that you had testing so we can call you. And this is the end of the class itself. Please, I'm open for questions. Following this, I'm going to go over the injection training. So for those individuals that have no experience with injections, I'd like you to watch this piece. But otherwise, I'm going to have you come back up to my office, and we are going to sit down and go over your name, your address, all your information. I can fill in what specific orders your doctor has given and talk over any questions you have. Hi, I would like to now go over with you the injection process and what's involved with this. The injectables that we will be having you give is Lupron and progesterone and oil. The biggest thing you can do before doing anything is wash your hands. Good hand washing. The Lupron is given between 5 and 7 in the morning. This is given, again, with a small syringe. So this is really a syringe that diabetics use. The needle is attached to the syringe, and you can see this is so tiny. It's fine and it's teeny. It's only going under the skin. So the needles are sterile. You will use a sterile needle with each injection. You will have a flip top on your Lupron when you initially get it. You'll flip the top off, and you can discard that piece. Wipe it off with alcohol. Your initial dose is going to be 10 units. So you're going to draw back your plunger. This is the plunger, so syringe, plunger, needle. Draw back your plunger to the 10. You're going to put that in the top and the rubber stopper and plunge. Invert the vial, and now draw back your syringe, your plunger, to the 10 mark. I draw it back a little bit more, and then I push up to the 10. The biggest thing I want to tell you when you're doing this injection is that make sure your needle is below the fluid line. If it's above it, you're going to get nothing. So make sure it's below the fluid line. Take it out, and now you're ready for injection. You have 3 options to give this: the back of the arm, the belly, or the side of the thigh. Most people choose their belly. Now, if you use your belly button as a landmark, I'm going to move over here so you can all see. If you use your belly button as a landmark, it's an inch away from the belly button. And draw an imaginary U around the belly button. You're going to take your alcohol wipe, wipe it down, and remember, the administration of shots, the best shots you're going to get are when the wrist is nice and limp here. It's nice and easy. It's like darts. Pinch an inch, dart in, push. That's it. Easy, easy. Because it's going under the surface of the skin, the other thing you may get is some bruising. So don't fret yourself that you did anything wrong. But again, wipe down, dart in, push. Now the other medication I'm going to go over with you is the other injectable here is this progesterone. Progesterone is in an oil. Now, the Lupron is in a water base. Much easier to draw up. Because of the thickness of this oil, it's a little bit more difficult, but not that bad. This is given with an IM injection, so a bigger needle. You will find when you open up the package that it's the needle's loose, so you need to make sure it's screwed on tight. So screw your needle on tight. I'm going to use this again as my demo here. You're going to take off your cover. Make sure you don't stab yourself again. Remember, sterile. You're going to draw back your plunger, and you need to put air into the vial again. So wipe off the top. Put the air in. Invert, and now draw back. And I'm going to pretend we're doing this with a half cc what we're going to be doing the first day, so half a cc. Now, if you have a bubble, you're just going to snap it out. If the bubble doesn't go away, you're not going to fret yourself. This is not going to do harm to you. if you are lean, on the lean side, I am going to be giving you extra needles, and you can change this needle and screw on another needle. And what you need to do, you screw on the other needle and you just prime it. Make sure you've got a little blip of fluid right there at the tip. And now you're ready for injection. The preferred site for this progesterone and oil is in the buttocks. Because it's an oil, it tends to become a little lumpy at the site. This site becomes tender. Now, I'm not a very good artist here, but if this were a buttocks, the place you're going for is the upper outer quadrant of the buttocks. It's the pocket line. So if you have pockets in your jeans, it's the pocket line. The rationale for this going up so high in the upper outer quadrant is that you want to avoid the sciatic nerve, which runs down the back side of the buttocks down into the leg. When I give this injection, I like the person laying down. I don't want the person looking at me. Our automatic reflex is to flinch. So when you're relaxed, it goes in much easier. You will take your alcohol wipe down the site. So if your partner's doing this, wipe down the site, pinch. And again, remember, it's all in the wrist. All in the wrist. Dart in, and you drop this needle in all the way. And when you see this, you think this is a big needle. But it's a thin needle. It's not that uncomfortable. So again, wipe down, dart in. You are now going to do one further step. You need to let go of your pinch, draw back. You're looking for blood. How far do you draw back? A little bit, just a tad. Dart in, draw back, push your plunger. Now let's say you draw back and you get blood. Not a problem, but we can't give the injection. So we get out of there when we drew back, screw on another needle, and go over to the other side. So again, dart in, draw back, push. What does it mean when you get blood? It means that you're in a vein. We don't want the medicine intravenous. We want it intramuscular. Now, there's a snowstorm or your husband's stuck on 128. You can't come home. What are you going to do for this injection? The alternate side is the leg, and it's the front of that thigh. Now, if you flex that leg, you're going to feel that big muscle right there. Sit down. When you're doing it, wipe, dart in, draw back, push. I prefer this in the buttocks. It tends to get lumpy. It's the oil that makes it uncomfortable. So what are you using your buttocks for other than when you're sitting down? That's when you're feeling discomfort. If you use this primarily on your leg, a lot of people will say their legs start to get achy. So I would avoid it unless you have to use it, but it's there if you need it. The other thing people have told me that's worked well for them is that especially if they're pregnant, they're doing this every night. It's for 10 weeks. It's a long time. Ice the site before. Put an ice cube on it before you do it so it's nice and numb. Unfortunately, because of the oil, it tends to still be a little uncomfortable at the site, but it seems to make it a lot easier. If you have any questions, so when you come back up to, after viewing this, you're going to be coming back up and we'll go over all this and I'll make sure that you feel comfortable doing all this. And if you have any questions or you need anything, please feel free to call me. Thank you.